In trauma-informed care, knowing the difference between reparative care and maintenance is important. But what is the difference? Let's take a look. The difference between reparative care and maintenance is something lots of people get confused with, not so much when talking about it, but when implementing care and interventions. So let's take a look at what reparative care and maintenance actually are.
Let's start with reparative care. Reparative care is a form of care that helps children to heal from trauma. It considers the trauma that they've experienced and the impact of that trauma, and then designs care and intervention that can help them heal. Trauma-informed reparative care is the type of care that many of the children that we support at our clinic need to start to heal.
So what is maintenance?
Maintenance is a form of care that holds a child where they are. It keeps them safe, but the focus isn't on supporting them to heal. It's called maintenance because we are maintaining them in a safe place, but we aren't supporting the healing process.
If that's the case, why do we need maintenance? Why don't we always use reparative care? Reparative care should always be part of our intervention planning. It should be at the forefront of our minds when we're thinking about the care that we're providing to children. But sometimes we need to use maintenance first to get a child to a place where we can use reparative care to help them heal.
There are a number of reasons why we would use maintenance. Consider a child who doesn't understand risk. They keep placing themselves in danger by approaching strangers, running into roads and touching or taking things they shouldn't have. In these circumstances, mitigation measures may be put in place to keep the child safe. Things like removing items that are unsafe or having a one-to-one plan where the child is an adult with them all of the time to ensure they're safe may be put in place. These mitigation measures ensure the child is maintained in a safe place, but they aren't providing reparative care. Nothing is being done to help the child heal and be able to judge and navigate risk in the future.
We see lots of situations like this with the children we support who are experiencing complex trauma from adverse childhood experiences. The trauma impact means that they can't judge risk, and mitigation measures need to be put in place to first establish and maintain a safe space before reparative care can start. When they're in a safe place, that reparative care can help them to heal. Something we need to remember is that often maintenance is needed to support children who've had adverse childhood experiences and are experiencing trauma before we can start implementing reparative care.
A different and common example of maintenance we also often see is where children who've experienced trauma are fearful of being on their own, so changes are made to their daily life so they're not on their own. Changes like them sleeping in their parents' bed at night, or parents and carers staying with them for all activities. These changes are really needed to help the child feel safe and can be part of the healing process, but if they continue for a long time and further reparative care is not considered, they can become maintenance, maintaining the child in a safe state but not repairing the core difficulty.
Maintenance is really important, but it's also really important to know when to use it. Maintenance should be used when you want to maintain a child in a safe state or stabilise them before reparative care is used.
You may also use maintenance if your child needs support in several areas. It would be too much for you and your child if you focused on all of these areas at once, so you may use maintenance in one area while you're supporting another area. For example, maintaining them in a safe state at home and not focusing on reparative care while you're focusing on integrating them back into school. The reparative care is taking place in school while you're maintaining them in a safe space at home. At some point you'll focus on reparative care at home, but right now the priority and focus is on supporting them to integrate back into school.
So if reparative care and maintenance are important, why do we need to know the difference between the two? Well, there can be times when reparative care is needed, and if we don't know we're using maintenance and not reparative care, we won't know to provide that reparative care. So it's really important that we can identify the difference between the two, so we can identify and provide reparative care when it's needed to support children to heal.
Consider the previous example where, because a child is unsafe within the environment, mitigation measures are put in place to ensure she is safe. Items are removed that she could harm herself with, and she has an adult with her most of the time. The risk has been mitigated, but as yet, no reparative care has been put in place. We are maintaining this little girl in a safe state, but the difficulty is also maintained.
When mitigation measures are put in place like this, often things get easier for the adults that are around the child.
The child is safe, so we don't have to worry, and we feel calmer and more at ease. It can be easy to forget in these circumstances that we need to implement reparative care, where the child can start to heal. If we don't implement reparative care, the chances are when we return items to the environment and allow her to go out on her own, nothing will have changed. She will still put herself at risk. This is why it's so important to plan and implement reparative care as well as maintenance.
Unfortunately, we've seen many situations where reparative care hasn't been implemented for a long time, and children are held in a state of maintenance.
They are safe during these periods of maintenance, but as the reparative care they need to heal isn't taking place, they miss out on development and healing. This can lead them to be vulnerable, ill-equipped to manage day-to-day, and in some cases can leave them in a state of trauma that impacts them into their future.
Knowing when you're providing reparative care and when you're providing maintenance is therefore really important. Both are needed, but knowing when to provide each one is really key to providing effective trauma-informed care. Before I finish up, here's one final trauma-informed care top tip. My top tip today is if you're caring for or supporting a child who's experienced trauma, reflect on the care that's being provided. Is it reparative care or is it maintenance? Both are great, but if it's maintenance, we really need to think about when that reparative care will be provided. Is there any plan for that? And if not, think about where you are now and where you want to go. That can be a really powerful tool in helping you planning your trauma-informed care and intervention. Thank you for watching, and subscribe to Tribe for more trauma-informed care in practice.